I just got my period last week. It feels weird and scary.
Do you know what a period actually is?
Sort of. It's when you bleed every month.
Your body prepares for possible pregnancy every month after you reach puberty. If you don't get pregnant, the lining of your uterus sheds and passes out of your vagina. Your period is the time when the blood, cells from the lining of your uterus and mucus are coming out.
What is the menstrual cycle?
Your menstrual cycle is the changes in hormones in your uterus and ovaries that make pregnancy possible. The menstrual cycle is about 21 to 35 days long for most people, but the average is 28 days. Your cycle goes from the first day of your period when bleeding starts to the first day of your next period.
So what happens in the cycle besides bleeding?
There are 4 main stages of menstrual cycle. Stage 1 is menstrual phase from days 1 to 5. That's when your uterus sheds its lining, the blood, and the tissues as no pregnancy happens. Stage 2 is follicular phase from day 1 to 14. Your brain releases hormones like FSH, follicle-stimulating hormones, to grow an egg in your ovaries. At the same time, estrogen rises and your uterus starts building a new lining. Stage 3 is ovulation between day 12 to 14. A hormone called LH, luteinizing hormone, spikes, and the ovary releases an egg. This is when you can get pregnant if sperm is present. Stage 4 is luteal phase from days 14 to 28. The hormones progesterone helps thicken the uterus lining. If the egg isn't fertilized, hormone level drop and your body prepares to shed the lining starting your next period.
What's the blood made of?
It's a mix of blood, tissues from a uterine lining, and some mucus. On average, people lose about 30 to 40 ml of blood and fluid. That's around 2 to 3 tablespoons during your period. Bleeding is generally heaviest for the first day or two, then lighter over the next day or two, and your period may finish with a day or so of spotting.
Is 13 a normal age to start?
Periods generally start between 9 to 14 years of age. This is often about 2 years after your breasts first start to develop and about a year after you start to grow pubic hair. Everybody's menstrual cycle is a bit different.
I felt really crampy and tired. Is that okay?
Painful periods are common, especially for younger women. This often feels like cramping in your lower abdomen or pelvis. For most people, the pain is mild. You may also have abdominal bloating, lower back pain, sore breasts, food cravings, mood swings, irritability, headache, and fatigue, all due to changes in estrogens and progesterone.
What can I do to manage the symptoms?
During your period, you can try gentle exercise, relaxation techniques, make time for enough sleep, use wet pad or hot water bottle on your tummy or breasts. Eat more whole foods such as fruits, vegetables, and whole grains to support your body's recovery. Stay hydrated throughout the day and reduce alcohol use.
Wow, that's a lot, but it actually makes sense now.
Periods might be a little uncomfortable sometimes, but they are a natural and healthy part of growing up.
I've started my period a few months ago, but I think something might be wrong.
Could you tell me what is happening?
Well, my period doesn't come regularly. Sometimes it's late or early, and last month it didn't come at all. Also, when it does come, I get really bad cramps.
Irregular periods are very common in the first year or two after you start menstruating. Your body is still adjusting to the hormones. That include late or missed period and even spotting between cycles sometimes.
Okay, that's kind of a relief. But what about the cramps? Sometimes they're so bad I don't even want to go to school.
Period cramps happen when your uterus contracts to shed its lining. Some discomfort is normal, but if the pain is severe or affects your daily life, we might need to look at some treatment options. Heat pads, gentle exercise, or over-the-counter meds like paracetamol can help, but if it's severe, we can talk to the doctors about other options.
Got it. And what about the spotting? It's only happened once.
A little bleeding between periods occasionally can be normal, especially in the first few years. But if it's become frequent, heavy, or painful, it's worth checking out more closely.
And I heard some people have really heavy periods. What counts as heavy?
Heavy periods means soaking through a pad or tampon every hours or several hours in a row, needing double protection like a pad and a tampon together, or bleeding for more than 7 days. If that's happened, let us know. This could be something like a hormone imbalance or even anemia.
Wow, I didn't know all this. Is there anything I could be doing to take care of myself during my period? Definitely. Here are some period care tips especially for beginners. Track your cycle by using a calendar or a period app. Change pads or tampon or menstrual cups regularly, at least every 4 to 6 hours. Stay hydrated and eat balanced meals as this helps with energies and mood. Move your body with gentle exercise can reduce cramps. Get enough sleep as your body needs rest. And most importantly, don't be afraid to talk about it or ask questions. I feel way better now. I thought I was just the only one going through this stuff. You are definitely not alone. Periods can be a bit confusing at first, but with the right information and care, you'll manage just fine. I have a young niece who just started her period at 7. Is that normal? Starting periods before 8 is not typical and can sometimes indicate an underlying issues like central nervous system abnormalities or hormonal imbalances. Okay, I'll tell my sister. I also have a friend who's 21 and never had a period. Is that normal? Right. That's called primary amenorrhea, means if your periods never started and you are 16 or older, or you are 15 and have no sign of puberty starting. And what if someone had periods but they stopped? That's secondary amenorrhea if you started having periods but they stopped for 6 months or more. Amenorrhea may have caused by strenuous exercise, stress, medicines like oral contraceptive pill, chronic illness, ovaries problems, hormonal imbalances such as polycystic ovarian syndromes (PCOS), or problems with your thyroid glands, hypothalamus, the part of your brain that helps regulate your menstrual cycle, or pituitary gland, anatomical problems with your uterus, cervix, or vagina, the absence of puberty, depressions, and some other forms of mental illness, low body weight due to eating disorder. Interesting. I've had irregular periods lately, skipping months. Could it be PCOS? Possibly. Irregular periods can signal PCOS, thyroid dysfunctions, or even perimenopause if you are nearing your 40s. For women between 40 and 55, late or irregular periods might be a sign of starting menopause. Do you also notice weight gain, acne, or excessive facial hair? A little acne. What about spotting between periods? I had some last month. It's not normal to bleed between your periods or after sexual intercourse. We'll need to investigate this further. Also, my periods have become very painful, like knock me out kind of cramps. Could that be something serious? Severe menstrual pain, especially if it's worsening, could be endometriosis, where tissue similar to the lining of your uterus grow outside of it. So, is it normal to start bleeding after menopause? Any bleeding after menopause is serious and it should be checked immediately. What's the best thing to use during a period to absorb the blood? It really comes down to comfort, lifestyle, and personal preference. Let's go through the main options. Pads are external and stick to your underwear. They come in different thicknesses, lengths, and absorbencies. Good for beginners or if you're not comfortable using internal products. Tampons are inserted into your vagina and absorb blood internally. They are great if you're active or swimming. Just remember to change them every 4 to 8 hours to avoid toxic shock syndromes. This is rare but serious. Menstrual cups are flexible silicones or rubber cups you insert into your vagina to collect, not absorb blood. They can stay in for up to 12 hours. Eco-friendly, cost-effective, and less odor options. Period underwear looks like regular underwear, but they have absorbent layers built in. You can wear them alone or as a backup with tampons or cup. Great for light days or overnight use. Reusable pads are cloth pads that you can wash and reuse. They are usually made of absorbent materials like cotton or bamboo. Menstrual sponges are natural or artificial sea sponges used inside your vagina. They are like a reusable tampon but without a string. They need to be changed every 4 to 6 hours and washed thoroughly after use. Menstrual disc is less common but growing in popularity, similar to cups but sit higher in your vagina canal. They collect blood and can be worn during sex, unlike most other products. That was so helpful. Follow Selenethenurse to learn more about your health.